Welcome to the CureCERT1 podcast. We are Wes and Samantha Rogers, parents of a beautiful daughter with CERT1 or CerTra Syndrome. We're searching for other parents and families around the world who are facing this rare disease, hoping to unite our voices, our strength, and our hope to find a cure for our children. This is more than just our story. It's about building a global community that will make a real difference. Join this parent-led movement, and together, let's shape a brighter future for our children.
We are rare disease parents as a result of Lottie's diagnosis of having a mutation to the CERT1 gene, which is currently being referred to as CerTra Syndrome.
So why did we create this foundation, Wes? Tell me more about that. Is it possible to cure CerTra syndrome?
So Lottie's diagnosis came about, how many years ago was it?
6.5.
6.5 years ago. And at that time, we got a single sheet of paper that had a few 4-line bios, and the words that stuck out were developmental delay, seizures, and it was devastating to see that. And there was nothing else they could provide to us. There was their sympathies, and they told us to do your best. And there wasn't really anything we could find online to help her as far as next steps, or to really know what to expect outside of those two things we saw that stuck out of the bios. So at that time, we didn't envision a world where there was much we could do for Lottie. That it seemed like it was too soon. And that everything that we wish that we could help her with was something that was 50 years, 100 years from now. And it wasn't for another 2 or 3 years until we learned about other families like her. We learned about a research paper that was written in 2023 about this disease. And then around that same time, I heard about the rare disease community. I learned that rare is not so rare.
It is typically considered that a disease is rare when less than 200,000 people have it. Right now, for CerTra syndrome, we sit at 48 patients that we know of at the moment. And yes, if you do know someone else or another number right now, what we have from the paper that was published in 2023 is that there are 48 affected people worldwide or internationally. And that number is growing, unfortunately.
Lottie is the only person in the world that we know of that has her mutation, but there's dozens of other families that we know of now that have her disease. And then beyond that, there's 400 million people around the world who have a rare disease. And that's, most of them, like Lottie, are results of a single gene mutation in your body. And so as a result of that, it's causing many of the same symptoms. But what I learned at that same time about 2 years ago is that some of these patients have been cured or treated for their disease. And it was a result of their families saying, hey, I want to do something about this, and I can do something about this. The science exists today. We have the tools through drug repurposing, through things called ASOs, it's a type of therapy, gene editing. There are other mechanisms or ways that you can treat and cure patients like Lottie, but they're so rare that there's not a lot of, that no one besides the parents have the will or drive or motivator to do anything about it. So like these other families who in some cases have delivered a cure to their child within 3 years, we've created a foundation. We are putting together the tools like them, trying to find other families so that we can then kind of project manage this cure together with the other families. It's really a family-led movement that's driving this. It's not a large pharmaceutical company. while they're very supportive and eager to help, it's really coming down to families saying, hey, we have the capacity and the desire to find a therapeutic and then drive it from discovery to clinical trials all the way to FDA approval so that our kids can be treated and that every kid diagnosed after that, when they get that diagnosis, are also handed, here is a treatment for your child. So that's kind of the motivation. That's the story behind this foundation and what we have been working towards for the last year. All right, so many of y'all have been wondering or asking us ways that y'all can be involved. What can y'all do now? It'll be different for parents of CerTra patients and our supporting family and friends. All of y'all can register on the Lotties Light Foundation website. There are like action steps, or for parents, there is a newly diagnosed page that goes through several steps you can do. But the first one is registering on our website. So the Lottie Light Foundation registry, this is our way of seeing who is on our team, whether you're a parent or not, ways you want to be involved. And then as we get to the different steps of the foundation, we have that list of who wants to be plugged in at the different things. So that's like the first and foremost. For parents of a CerTra patient, another thing that you can do is to get plugged in with an existing study. That paper that was written last year by Dr. Gennarino and Dr. D'Angelo, they're continuing to study our disease.
And all of these things will be linked so that you can take a look at what you're saying.
Yeah. So that, if you're not already on it, I know for some of you that we've talked to, you've already connected with Dr. Gennarino. So that's great. You're already a step ahead of some of us. So if you're not, though, and you want to be included in that study, great opportunity to get, make sure your child is being represented in that study. The next thing is really for everybody, fundraising. We want to start actively fundraising for CerTra Syndrome to develop a cure. So to your family, your friends, if you're part of any clubs or community groups, if you're part of any religious groups, church, and you'll have small groups or events like that you can share your story and get people excited about the work we're doing and letting them know we're working towards a cure. Here's a place you can donate for that. We're putting together a scientific advisory board to help with what to do with the money, meaning there's a million ideas, right, of where we could put the dollars, more research, more, and there's a ton of categories of research, right? So we want to make sure that we have scientists who have been involved in translational medicine, meaning taking the study of a disease to curing that disease, right? Taking that information and then applying it to the patient's life and making their life better.
So moving from the research lab to patients' lives. We don't want to just be excellent study subjects. We want to live excellent lives.
So having a scientific advisory board will be really crucial to make sure that we have a team that are considering the different options in front of us to say, okay, what's the most effective use of the dollars we've raised thus far to get us that much further or closer to getting the therapeutic to our kids. So that's going to be really awesome to have these folks helping us with this.
So the next steps that you will all be hearing about a lot are our big pushes for creating and gathering a patient registry. This is going to be not just on our website, but more of a formal registry of patients with who you are. This would be the diagnosed person. So who they are, birthday, all of their information that we can gather so that we can use that to contact you when we start gathering information for a natural history study. I know that all of these things are new and they were new to us as well, these phrases and these things that we need or that we're moving toward. But the reason we need a natural history study is because it can pinpoint what our hopes for future treatments are. That being said, we gather that information from the time someone is born all the way over their lifetime in order to observe when do they start having seizures, when do we start noticing cortical visual impairment, perchance, or GI upset. When do they say their first word, if ever? Do they remain nonverbal through the course of their life? And when we can see this, we can step back and put all of those points of data together over the course of a lifetime for every person diagnosed with CerTra syndrome and start identifying some markers that we could potentially change on a chemistry level. And when I say we, I don't mean me. I mean the researchers and the scientists who are actually doing this to say, if you could change one thing about the life of your child diagnosed with CerTra syndrome, what would it be? And so we can gather these data points and lay them out over time and see how can we help our kids. And that natural history study will be a gathering of all of that information.
So this is not something that Lotties Light Foundation will be doing. This is something we are actively looking for partners, basically biotech companies who have these softwares to gather all of our patient records. Also, this will probably involve surveys where we're talking maybe let's say a survey specific on seizures and if you have those and or if not, and if so, what those look like. So these are something that will be coming quick. We don't have them yet, but be ready for them because we want to start telling the story of what this disease looks like in each of our families' lives, even how it directly impacts our children. But also some of this takes a look at how does this impact your family as well, because all of those are important data points to have when developing therapies and getting those FDA approved. So kind of with the finish line in mind, we have to start at the very beginning of telling the story of our disease.
And gathering those.
So be on the lookout out for when we post those and tell y'all, hey, we have identified an organization to do our natural history study or to do our patient registry, which again, I think it's important to point out this is separate from our Lotties Light Foundation registry, which is really just us building our team, right? So like registering for the group, whereas a patient registry is a way of getting your medical records and surveys and data points about a specific patient. So hope that helps.
We have had the honor of meeting some of you recently, newly diagnosed. That is a burden that we are able to shoulder with you. Going before you, only 8 years ahead, but knowing how hard the road can be in just getting a diagnosis initially. And those of you who have gone before us, we are hopeful and excited to get to know you and to hear more about your story. And so you all have had the opportunity to learn a little bit more about Lottie that we've shared on Facebook or Instagram. And we would love to hear your story. We would love to know your diagnostic odyssey. We want to know your child. We want to get to know you as a family and the way that you have come to the point where you are, how you're able to care for your child, even sharing information that's really helpful across the board as far as what doctors are prescribing, what neurologists are seeing on your EEGs. Of course, all of this is as long as you're comfortable sharing, but when we come together as one unit, we are much stronger together and supporting one another. So if you feel led or comfortable, please go to our LottiesLightFoundation.org, and under For Families, there is a Share Your Story tab. You can put pictures or videos as long as you're comfortable, and know that we would love to be able to get to know you more through that. In future Instagram posts and Facebook posts, we would love to be able to share the many beautiful faces of CerTra syndrome and the stories that are, nuanced and beautiful there. So we're looking forward to hearing from you guys as well and hearing more about your story and your background. We hope y'all enjoyed this episode. If you have topics you would like us to cover or people you think we should invite, or if you would like to join the conversation and share your story, please send us a note at hello@lottieslight.org. And remember, together we will illuminate a cure.